Which disease is caused by a deficiency of dopamine in the brain? Parkinson's disease, multiple sclerosis, epilepsy, Alzheimer's disease. The correct answer is option A, Parkinson's disease. Which disease is characterized by abnormal cell division in white blood cells? Hemophilia, leukemia, anemia, thalassemia. The correct answer is option B, leukemia. Human immune deficiency virus HIV causes illness by attacking a type of white blood cell called B cells, neutrophils, CD4 plus T cells, eosinophils. The correct answer is option C, CD4 plus T cells. Which salivary gland is most commonly affected by sialolithiasis? Submandibular gland, parotid gland, sublingual gland, minor salivary gland. The correct answer is option A, submandibular gland. Hemophilia is known as the failure of heart to contract, kidney to filter, stomach to digest, blood to clot. The correct answer is option D, blood to clot. TB vaccine is useful against polio, dengue, malaria, typhoid. The correct answer is option D, typhoid. Which disease is transmitted by mosquitoes? HIV, AIDS, hepatitis B, malaria, asthma. The correct answer is option C, malaria. BMD test is done to detect dengue, malaria, osteoporosis, AIDS. The correct answer is option C, osteoporosis. Which of the following immunosuppressant help prevent transplanted organ from being rejected in recipients? Amoxicillin, cyclosporin, paracetamol, aspirin. The correct answer is option B, cyclosporin. Which organ is affected by diphtheria? Throat, brain, liver, skin. The correct answer is option A, throat. Which disorder is associated with the loss of myelin sheath around nerves? Alzheimer's disease, multiple sclerosis, epilepsy, none of these. The correct answer is option B, multiple sclerosis. Which of the following disease was eradicated globally due to successful vaccination campaigns? Polio, smallpox, measles, tuberculosis. The correct answer is option B, smallpox. Which of the following diseases is caused by bacteria? Diabetes, typhoid, AIDS, cancer. The correct answer is option B, typhoid. Which of the following vaccines is primarily used to prevent pneumonia? Influenza vaccine, pneumococcal vaccine, MMR vaccine, hepatitis B vaccine. The correct answer is option B, pneumococcal vaccine. What is the main symptom of jaundice? Red skin, yellowing of skin and eyes, swelling of joints, dizziness. The correct answer is option B, yellowing of skin and eyes. Minamata disease is caused by consuming fish that contain high levels of which of the following substances? Lead, arsenic, methyl mercury, cadmium. The correct answer is option C, methyl mercury. Which of the following diseases is related to abnormal hemoglobin and red blood cells? Sickle cell anemia, thalassemia, leukemia, both A and B. The correct answer is option D, both A and B. A kind of injury or damage that results in the premature death of nearby cells in a tissue or organ through autolysis is called apoptosis, necrosis, inflammation, regeneration. The correct answer is option B, necrosis. What rare disorder caused by the buildup of fluid in the brain is commonly treated by surgically inserting a shunt to drain excess fluid? Hydrocephalus, epilepsy, Parkinson, meningitis. The correct answer is option A, hydrocephalus. Consumption of high levels of nitrates can lead to which of the following conditions? Blue baby syndrome, scurvy, osteoporosis, hyperthyroidism. The correct answer is option A, blue baby syndrome. Which condition is characterized by frequent uncontrolled electrical activity in the brain? Parkinson's disease, epilepsy, stroke, multiple sclerosis. The correct answer is option B, epilepsy. Which of the following disease is also known as the kissing disease because it is spread through saliva? Influenza, mononucleosis, mumps, measles. The correct answer is option B, mononucleosis. Carcinoma arises from which type of cells? Muscle cells, epithelial cells, nerve cells, bone cells. The correct answer is option B, epithelial cells. Which of the following diseases is caused by a deficiency of insulin? Alzheimer's disease, diabetes mellitus, heart disease, hyperthyroidism. The correct answer is option B, diabetes mellitus. Which disorder is characterized by progressive loss of memory and cognitive function? Parkinson's disease, Alzheimer's disease, multiple sclerosis, epilepsy. The correct answer is option B, Alzheimer's disease. Melanoma is a type of cancer that develops from which of the following cells? Adipocyte, melanocyte, fibroblast, lymphocyte. The correct answer is option B, melanocytes. What is the primary cause of coronary artery disease? Bacterial infection, cholesterol buildup, viral infection, lack of exercise. The correct answer is option B, cholesterol buildup. Which genetic disorder is characterized by progressive muscle weakness and loss of muscle mass? Hemophilia, muscular dystrophy, Down syndrome, Turner syndrome. The correct answer is option B, muscular dystrophy. What condition occurs when the immune system mistakenly attacks the insulin producing cell in the pancreas? Type 2 diabetes, type 1 diabetes, Cushing syndrome, Parkinson's disease. The correct answer is option B, type 1 diabetes. Which of the following is the combined vaccine given to children for protection against tetanus, whooping cough, and diphtheria? MMR vaccine, DPT vaccine, IPV vaccine, HIV vaccine. The correct answer is option B, DPT vaccine. Which part of the human body is primarily affected by tuberculosis? Kidneys, lungs, liver, skin. The correct answer is option B, lungs. Which part of the human body is primarily affected by cholera? Stomach, large intestine, small intestine, liver. The correct answer is option C, small intestine. Which disease is an autoimmune disorder affecting joints? Osteoporosis, rheumatoid arthritis, asthma, Alzheimer. The correct answer is option B, rheumatoid arthritis. Which of the following disease affects the airways and causes difficulty breathing? Asthma, bronchitis, cough, all of the above. The correct answer is option D, all of the above. Which bacterial infection is known to cause severe diarrhea and dehydration? Cholera, typhoid, hepatitis A, E. coli infection. The correct answer is option A, cholera. What is the primary condition characterized by swelling of the membranes over the spinal cord and brain? Encephalitis, meningitis, mellitus, neuritis. The correct answer is option B, meningitis. Which disease is caused by the buildup of uric acid crystals in the joints? Arthritis, gout, osteoporosis, none of these. The correct answer is option B, gout. Which disease is caused by a mutation in the CFTR gene leading to the production of thick sticky mucus in the lungs and digestive system? Cystic fibrosis, Turner syndrome, Down syndrome, muscular dystrophy? The correct answer is option A, cystic fibrosis. Which disease is characterized by high blood glucose levels? Hypertension, diabetes mellitus, anemia, arthritis? The correct answer is option B, diabetes mellitus. Which of the following heavy metals is responsible for ittai disease? Lead, mercury, cadmium, arsenic? The correct answer is option C, cadmium. Which of the following disease is often called the silent epidemic because many people are unaware they have it? Diabetes, hepatitis C, Alzheimer's disease, hypertension? The correct answer is option B, hepatitis C. Which disease results from the body's inability to produce enough cortisol and aldosterone, hormones produced by the adrenal glands? Cushing syndrome, Addison disease, Graves' disease, none of these? The correct answer is option B, Addison's disease. AIDS virus spreads in the body through suppressor T cells, carrier T cells, helper T cells, killer T cells? The correct answer is option C, helper T cells. Which of the following disease can be transmitted through animal bites, most commonly dogs? Tetanus, rabies, tuberculosis, cholera? The correct answer is option B, rabies. What is the most important characteristic symptom of rabies? Fever, hydrophobia, nausea, rash? The correct answer is option B, hydrophobia, fear of water. The time period between entering of pathogen into the body and appearance of symptoms of disease is called adaptation period, reserve period, incubation period, none of these. The correct answer is option C, incubation period. A sudden onset of a disease with rapid change is commonly known as chronic, contagious, acute, non-contagious. The correct answer is option C, acute. Which of the following is a viral infection of the liver? Hepatitis, cirrhosis, nephritis, gastritis? The correct answer is option A, hepatitis. Which type of hepatitis cannot be transferred by blood or sexual contact? Hepatitis A, hepatitis B, hepatitis C, hepatitis D? The correct answer is option A, hepatitis A. Which infectious disease is characterized by a red rash and high fever? Measles, mumps, chickenpox, influenza? The correct answer is option A, measles.